Good morning and welcome to BSI and to today's webinar, Managing Health and Safety, the Here and Now. My name's Carla White, I'm the Senior Client Engagement Manager at BSI. So introducing our speakers for today, as you've heard, my name's Carla White and I'm delighted to be joined today by Kate Field. Kate is our Global Head of Health, Safety and Wellbeing, and she has a health and safety career spanning 2 decades. Kate has authored regulatory and technical guidance, written articles for a range of publications, and is our global keynote speaker and presenter. So it's great to have you with us today, Kate. So before I hand over, I can see many of our clients on this webinar today that are well known to us, so welcome to you all. It's also good to see a number of new faces, and we're delighted to have you with us today to talk about managing health and safety right now. Just to explain a little bit about the BSI group, many of you will be familiar with BSI as the UK national standards body. We have a strict governance to our business streams and are incorporated by Royal Charter. We support organisations globally in lots of different ways, so shaping international standards, providing technical support and guidance from our knowledge solutions business. We have the assurance business, which provides training and certification services that essentially help clients to embed and demonstrate best practice through adoption of those standards. And then we provide consultancy on a range of topics. So moving on, our strategic purpose at BSI is inspiring trust for a more resilient world. And we do this by shaping and guiding innovation through improving and standardizing in those areas such as business processes, products and services that support advancement for our clients. We're completely independent, we're free from any outside influence, as all profit is actually reinvested back into BSI to help us to continue to support and drive further change. Prior to COVID-19, health and safety was already a key priority for many of our clients, and that now this becomes even more a critical objective. Together we're very much facing the challenge of adapting to the next normal and ensuring safety and well-being of all involved and in protecting our people. So we're very much here to help by serving our clients and finding new ways of delivering services to support industry that are focused upon enabling organisations to survive, stabilise, rebuild and become more resilient. So we've actually developed a framework for helping clients to improve organisational resilience, and details can be found on our website. Now, in just a moment, I'm going to ask you a question, but before I do that, I'm just going to give you a little background. So obviously the recent rapid spread of COVID-19 pandemic has meant that governments and organisations have had to respond quickly in order to minimise all but essential social contact and to protect the safety, health and well-being of their people. So the existing BSI organisational resilience framework has now been applied in a 4-phase disruption model that's designed to help clients respond to the COVID-19 pandemic and to stay safe and secure during periods of restricted movement and to start the journey to resilience in their next normal. So details again can be found on our website, but this is what it looks like, and we really want to understand where you see your organisation right now. So for example, are you at the survive stage? So this is where you're getting to a place of relative safety together. You may be undertaking a reappraisal, developing a survival plan, plus maybe looking to keep trading whilst ensuring the safety and welfare of your employees. You might be at the stabilised stage where you are maintaining safety, security and well-being. With immediate critical changes decided upon and implemented, you may already be seeking to find that new state of balance for your organisation to ensure that you keep functioning to the best of your ability, given the imposed and amended operational constraints. Perhaps you've already dealt with the first 2 stages, you're now focused on the rebuild stage and setting a revised course for this next normal. So as governments start to reduce restrictions on freedom of movement and social distancing and eventually travel, the exit strategy is likely to involve a phased lifting of restrictions. Or actually, is your organisation already at stage 4, where resilient, where you are forward planning to achieve a secure future? So the world is very likely to have changed for good as a result of the pandemic, and with new ways of working, you may have identified significant opportunities to do things differently. So we're going to launch this poll now, and then we'll share the results with you. So where do you think your organisation is at this point? Please select one of the options on the screen. So survivors getting to a place of relative safety whilst facing new daily challenge. Stabilises maintaining operations and organisational safety, security and wellbeing. Rebuild is setting a revised course to return to business as usual in the next normal. And then resilient is forward business continuity planning to build a more secure future. And this is what we can see. So that's really interesting. So we have the majority of people are in the rebuild phase, which is really, really positive. So I'm now going to hand over to Kate to begin today's session and to maybe offer some comments on the poll results. Over to you, Kate.
Lovely. Thank you, Carla, and welcome to everybody who's joined us today. Thank you very much. And yeah, that is really interesting. I think you know, a lot of organisations are starting to look at that rebuild because, you know, a lot of the restrictions that we've been facing are starting to be lifted, and organisations are looking to, you know, go back to work or continue work or, you know, upscale in terms of the activity that they're doing. So I think that's fantastic, and hopefully, you know, there's what we're going to cover today will help and support you on that journey. So I'm just going to, in terms of today's session, I'm just going to cover kind of a really quick recap on COVID-19 itself, the general risks and controls, because I think that's important to set the context before we start looking at the workplace issues. And in terms of looking at the workplace, I'm going to focus really on three key areas, because this is where we've seen kind of the most questions from our clients, and kind of the areas that I think organisations, you know, have been struggling with or finding some challenges. So we're going to focus on social distancing, the hygiene management, and supporting vulnerable workers. And we will be aiming to leave time at the end for questions and answers. But we've got an amazing selection of knowledge on the end of this call. So I'd really encourage you, you know, actually in that Q&A, you use the chat function to share your own experiences or best practice to really help and support each other, because I think that's one of the things that has been really valuable to our clients is where they can hear the experiences of others. So in terms of the understanding the virus itself, it is important because it will help us actually manage the risk proportionately. And I think, you know, there's so much in the news and media that it's sometimes difficult to maintain that sort of maintain that proportional view about it and actually the risk it presents. And really importantly, that helps provide the reassurance to our own employees, but also to customers that we may be engaging with. And it's also important to understand that that principle of understanding the virus helps prevent social stigma and discrimination. And social stigma is where negative associations are made between a person or group of people and a specific disease, obviously in this context COVID-19, and people may be labelled, stereotyped or discriminated against and treated differently, and we have seen this happen globally, unfortunately. You know, people of certain ethnic backgrounds, but also interestingly those who are perceived to be in contact with the virus, so particularly healthcare workers, and this is something for you as an organisation to consider as you reopen, is actually particularly if you're customer facing, then your employees may be seen as being in greater contact with the potential virus. And, you know, we have seen this increase in escalation around violence and aggression. So that's something for you to just to be aware of. And, you know, keep up to date with the risk management guidance from credible sources. I think one of the challenges we've got is, you know, this is a new virus and, you know, information is changing almost daily. But, you know, identify those credible sources and keep up to date with them. So just a really quick recap on the biology of COVID-19. So it is spread by the respiratory droplets. Those are emitted when we're particularly coughing and sneezing. Those droplets are relatively large and heavy, and so they don't travel very far, and they fall to the ground or surfaces and clothing. They don't linger in the air, but if you are close enough to a person when those droplets are expelled, they can be breathed in. So this is where the social distancing becomes important. And you know, there's still a lot of research going on, but it does seem that the virus can actually remain alive on skin and surfaces for a few hours or even days. So, that gives us kind of the context about why the controls that we have in place are there. So the personal hygiene, so that's very much the respiratory etiquette. So covering your face, your nose and mouth when you're coughing and sneezing, ideally with a tissue, and then disposing of that tissue. The washing of the hands regularly, or using hand sanitizer. Maintaining the social distancing, and there's interestingly, different countries in different parts of the world have used different guidelines on that. It's the World Health Organization talk about 1 meter, Australia it's 1.5, in the UK it's 2 meters, but the social distancing is important, and it comes back to about how far those respiratory droplets actually travel, and minimizing contact with people. The less contact you have with people, the less exposure there is, and then obviously the last element is, if you have symptoms, to make sure that you self-isolate. So it's important just to kind of have that context, because then it helps us translate that into risk management within the workplace itself. So certainly seeing a lot of questions around the approach to risk assessment. And I think, one of the things that I've been asked, and I don't know whether this is something that you've been experiencing as you've kind of started to tackle this question, is whether a generic risk assessment will work. You can do one sort of COVID-19 risk assessment and that will apply to all of your sites. And I think that's unlikely to be the case, because each location will have its different risks and issues. So that does mean that you need to approach it in terms of looking at kind of site specific issues. And the key thing is that the risk assessments themselves do need to be agile and dynamic. Things are changing. For those of us who are based in the UK, there's a lot in the media at the moment about potentially changing the rules around how far the social distancing is. So for organisations that have been looking at, using 2 meters, potentially there's going to be a change of approach, and that will be reduced to 1 meter, possibly. We don't know yet. But, you are going to have this agility in terms of the risk assessment. But the principles in terms of what you need to focus on, remain consistent. It's around, where are the transmission and exposure points, and what's the likelihood of that exposure? Who are your vulnerable people? And how you can protect them. Identifying the what or the who are essential to get your organisation into that rebuild phase, so that you can operate. I've touched on keeping up with the guidance. It is a challenge, but the other one to remain focused on is safety critical people or activities, and making sure that they're being managed. So we've had a lot of questions come in around obviously things like water system management in buildings where they've been shut down, and things like the Legionella checks haven't necessarily been done. So actually it's keeping on top of some of those safety critical or higher risk activities. And the key thing is, as while we're thinking about all of that, and it's a lot, I'm a health and safety professional, and we've been looking at this in BSI, and I've, it's hurt my head sometimes. I'm sure you all have felt that. But I think one of the things that I've seen is there's obviously so much focus on understanding COVID-19 and what we need to do as an organisation, to protect our people. That's what we want to do. That we sometimes are losing sight of all the existing risks that are, haven't changed, are still in the workplace, but that risk profile might have changed. So, I mentioned, for instance, the issue around violence and aggression. Now, maybe if you've got employees who are customer facing, then it's probably a risk that you've already identified. But at the moment, it does seem that risk profile, that risk has probably increased. There is this anxiety and this tension, because of the lockdown and the fear that's around COVID-19, that means that might have increased. So it is important to consider that, existing risks and how they may have changed. And the other thing is don't forget the non-routine and in emergencies. So, we're thinking about reopening our offices, for instance, and how we space our desks. But what do we do when the office printer breaks down? how do we manage the contractor? So it can be really simple non-routine activities, but particularly those maintenance and breakdown activities is one to really consider. And of course, emergencies. This is a really interesting one. So again, a lot of organisations haven't thought about how to manage a fire evacuation if you're social distancing. And of course, the key is during the evacuation, you can't, you need to just get people out. But people need to be reassured that that's the process and they don't have to social distance while they're trying to walk down the stairs to get out of the building. So it is important to consider that, and things like first aiders as well, they'll have additional questions. And, in terms of things like first aiders, again, they're kind of potentially safety critical roles. Have you got enough first aiders or enough fire wardens, actually in work to cover evacuation or emergencies as they occur? So, there is an awful lot to think about. But in terms of, your risk assessment, you can do a COVID specific one, or you can update your existing risk assessments, but kind of with a COVID-19 lens on them. But it is important to try and be proportionate in terms of what you're doing. A lot of the controls that you'll have in place, will be in the right lines anyway, so try and manage that proportionately. Okay, so thinking about the controls, so kind of following that high level principles that we've seen in terms of managing the virus itself. So it starts with hygiene. There's obviously the respiratory etiquette. So you want to encourage people to maintain that respiratory etiquette. And, some of the things that I've seen organisations do, and I don't, again, please feel free to share your experiences, in the chat box, and we'll try and cover some of them as we get to the end, is, actually having extra boxes of tissues around the workplace. So, if suddenly somebody finds themselves without a tissue, they've got easy access to one. Really simple approach. But of course, if people are using tissues more, then they need somewhere to dispose of them safely. So increasing the number of waste bins is a key one. I know one of the things that we're looking at reopening one of our London offices, and I've always found it quite fascinating because we have, we've done the right thing in terms of looking at our sustainability, our environmental and recycling credentials, and we have, central bins in central places so that we can sort our rubbish. But of course, they're not close to desks. And you don't want people wandering around with lots of dirty tissues. So, there's some really practical things that you can consider. Obviously, within the hygiene piece, it's making sure that people understand what your own policies are in terms of, the illness. So if people are showing symptoms and return to work, what the process is within your own organisation. So within the context of hygiene, then obviously, it's can you create more personal hygiene points, so pop-up points. So this might be additional hand sanitizers spaced around the location that you're in. On reception desks, we're seeing that quite a lot of, but actually, kitchenette points or entrances in and out of toilets, actually thinking about where you can put those additional hand sanitizer points. For some organisations, particularly if they've got large sites or construction sites, they've added in additional temporary welfare facilities. And that can be really effective, but if you're doing that, particularly if you've got outside locations, I've seen quite a lot of organisations again put a sort of extra hand sanitizer points out, sort of scattered around outside, but they're not necessarily waterproof or weatherproof. So again, thinking through some of the scenarios when you're adding some of those controls is important to do. I think one of the things the other question I've seen come up is around what about hand dryers? And the guidance is that paper towels rather than hand dryers if possible, because it's a more effective way of getting the moisture off, and actually depending on the nature of the hand dryers, there's usually or potentially an activation of pressing a button, which obviously becomes a contact point. So it does depend on the nature of the hand dryers. So the other aspect really of hygiene then is the cleaning. So this is the what to clean and how often to clean it. And you've got to think about your workplace. So your workstations, your work desks, entry and exit points, doorways, those sorts of things. But again, the sorts of areas that organisations have maybe sort of not considered is plant rooms, so you might have plant up on the rooftop that needs maintaining, your ventilation system, your air conditioning system. Somebody's going to be going up there to do the maintenance. So should that be cleaned? How often should it be cleaned? Storage rooms or storage containers, that same piece around, not forgetting those maybe less used areas. And of course, the other one is, things like kettles, microwaves and dishwasher handles, if you've got them in your workplaces. These are frequent touch points within the organisation, and they'll need to be cleaned regularly. A lot of organisations are doing things, particularly for doorways, leaving them open or removing the things like biometric security, whereas like fingerprint access, which is great for helping in terms of those touch point risks. But what's the implication for security or fire safety? So again, that process of working through and thinking, right, well, this is a solution for our COVID situation, but does it then change the risk profile of existing risks? And that's important to remember. The other thing, of course, kind of within the workplace is tools and equipment. So the obvious things for offices is, the computer equipment, keyboards, that sort of thing. But I've mentioned things like the office printer sometimes gets forgotten, spider phones, maybe if you're construction sites or other, wheelbarrows in maybe manufacturing or you've got pump trucks, there's a whole range of other equipment, and you'll need to identify and think about how often you're cleaning, and in simple terms, the more often something is touched, the more frequently it's going to need to be cleaned. The other one, thinking within hygiene is if you have vehicles. So if you've got vehicles that are used for work, then they'll also need to be cleaned. Ideally, people are using their own vehicle, but where you do have your own vehicles, then can you limit that a vehicle to a person? Again, that helps manage the risk, but that's not always possible. So you will need to think about the cleaning regime with vehicles, and the principle's the same. What's touched and how often is it touched? And again, a lot of organisations will get the drivers to clean when they enter the vehicle and then clean when they leave as well. So again, door handles, seat belts, the gear shift, the air conditioning control buttons. There's quite a lot to think about. And in a lot of cases, what organisations are doing is obviously then providing individuals with the cleaning materials to do that cleaning, which is is a good solution. But again, what additional risk does that potentially introduce? So those cleaning materials will have chemicals in them. What's the risk associated with those chemicals? And you've got people who may have asthma or other respiratory issues that and those cleaning materials might trigger it. And of course, one of the big issues with hygiene, the use of more cleaning chemicals or hand washing or hand sanitizer is dermatitis. So that's something you might need to think about in terms of part of your communication strategy, is give some people education about dermatitis and what to look for and how to manage it. And then kind of the last thing to think about in terms of the hygiene piece is the routine cleaning that you're kind of doing on a regular basis versus maybe a deep clean after a known or suspected COVID-19 exposure. So, when if you have the situation where actually somebody in your workforce is confirmed or is suspected of being unwell, but they've been in the workplace, then you may need to do a more thorough deep clean in terms of that management process. So it's the routine and the deep clean that you'll need to consider. And the other one, kind of on the hygiene, and it starts to move into our next subject, is social distancing, is toilets. So again, the way a lot of toilets in workplaces are designed means that it's very difficult to manage social distancing, particularly sort of the entrance and exit out, in and out of the toilet. So what can you do to manage that? So again, I mentioned already that you can potentially put hand sanitizer at the entry to the toilet, so people sanitize their hands as they go in and then as they come out. That can help in terms of the hygiene. Or you potentially put a lock on the main door, so that actually, even if it's a toilet facility that's got 3 toilets in, if the lock's on the main door, it's only ever one person in there at a time. So there are different solutions, but obviously you have to consider that in terms of the number of people within your organisation. That brings us then into social distancing. So I'm sure you've all been having some really interesting experiences and discussions about how to manage social distancing. So this is, our primary control. And the best way to manage social distancing is to keep people working at home if they can. But that's not always practical for a lot of activities. So where it's not, then it's a question of looking at what's the minimum number of people that you can have in the workplace in order to do the job effectively. So if you're more in a manufacturing environment, that the manufacturing might need to still be done, the people on the kind of shop floor production line, but actually maybe some of your sort of administrative functions don't actually need to be in the factory. They can still work at home. So what does that sort of look like? Obviously then looking at social distancing in the workplace where you do have people coming in and how you manage that. So, there are a number of different ways of doing it. You can look at the overall sort of capacity of your workspace, the square footage, and do some maths to work out what that means in terms of the number of people. You can get a tape measure out and start measuring the distance between workstations and work desks. So there are a number of different ways that you can do that, and you've got to consider what's practical for your organisation. It is possible, obviously, it might be possible to move workstations or desks or things like, containers or work areas further apart to help manage that social distancing. So there are a number of different ways of doing it. But again, it's not just the direct work areas, it's the entry and exit points in particular, the kind of these pinch points, but welfare and break facilities, lifts, you've got the image there. But corridors, your movement around your workplace, what does that look like? Where does that create pinch points? Smoking areas, isn't it another one that's often kind of not thought about, and delivery and dispatch points. And coming back to kind of our emergency, I've again sort of one of the things I've seen some organisations do is obviously during the evacuation you can't social distance, but once people are out of the building, you can maybe create additional assembly points to socially distance once they're out of the building. So some things to consider. And you can see, I think we've all seen more and more yellow tape everywhere that we go, and signage, but marking out what those distances are. One-way systems are good for helping in terms of pinch points, and a lot of organisations on the entry and exit points have created, additional entry and exit points into the workplace to help manage the congestion. Or where you can't do that, staggered start and finish times again can help in terms of managing the congestion of those pinch points and making sure that you're minimising the number of people who are in the same place at the same time to manage social distancing. Technology is a great way to help with the social distancing, so web-based inductions, and it is important that as you reopen your organisation, or as more staff who have maybe not been in the workplace come back in, they're going to need to be re-inducted. They're going to need to understand the rules. You're going to have to update them in terms of what to do in a fire evacuation, how the social distancing works, that they are, it's almost, you need to think about them as new people coming in, so they will need to be re-inducted, but you can do that by web. Obviously, postponing any non-essential training or meetings, doing the ones that are essential remotely. Using phones for communicating on site. So if you need to speak to somebody, rather than, as silly as it sounds, wandering over to them and having a chat or yelling at them from 2 meters away, is actually, can you phone them, or potentially introduce, radios, walkie-talkies. These are sort of some practical solutions that I've seen some organisations actually come up with. And things like remote audits, they can be done, or site inspections, some aspects of those can be done remotely, and using technology. So there are a lot of solutions out there. So then some of the other aspects to think about in terms of the social distancing is, we've been encouraged not to use public transport, because obviously that increases our potential exposure, and to use our own cars if that's possible. So you might need to think about additional parking on your sites, or to use things like bikes, in which case again you'll need to think about secure bike storage. And if you're introducing bike storage or increasing bike storage, then again, that's potentially a touch point, an exposure point that then needs to be part of your hygiene regime, your cleaning regime. So there's a lot to think about there. So if you can't social distance, what do we do? Oh, actually, just before we move on, I've just seen that last bullet point, which is it's on there for a reason. So I think one of the things I've seen a lot of organisations do is run inductions or meetings outside, which is great when we've got good weather. But what happens when we get bad weather, and as we move into colder weather in the winter, that becomes less practical. So starting to think about what the solutions will be as we have the seasons change is something to consider. So if you can't social distance, so what are the other things that you can be looking at? So, again, the guidance is hygiene and social distance, and then looking at these other controls. So you can do things like limit the activity time. So, the greater that the longer that you are with somebody or close to somebody or people, the higher the risk. So actually, can you shorten the time that you are doing a particular job? You might be able to do, one person can do one activity for a short time, and then rotate over to another job. So there may be different ways of managing that. Job rotation needs to be managed carefully, because what you don't want is lots of people doing swapping between lots of different jobs, and because you're just increasing potential exposure across more people. But it's something that you could consider. Screens and barriers. So, particularly in a lot of manufacturing environments, you've got fixed production lines, and, you just can't manage the social distancing. You can't spread out the production line, in which case screens and barriers can be a really good solution. I think the thing to consider with that is, of course, they become another exposure point. So they then need to be cleaned. I saw a really good temporary solution of cardboard as a barrier, but of course cardboard can't be cleaned, so it'd have to be replaced. So again, it's thinking through some of those scenarios in terms of if you introduce that as a control, again, what you need to manage it. So you might have, if you were paying close attention to the picture on the previous slide of the lift, you might have noticed that the footprints that were marked out on the ground, they were all facing away from each other. So again, and in this image, if you can't kind of manage the social distancing, or screens and barriers aren't practical, can people work back to back or side to side? Because again, it comes back to understanding the transmission of the virus. It's the exhalation of these respiratory droplets. So if people are working back to back, then they're not being exposed to any respiratory droplets that are emitted, because the droplets are going away from them. So that can be a solution. So work bubbles. So this is particularly a phrase that I've seen in the UK, creating work bubbles. So that's where you have a fixed team or two individuals working together to do a particular task, and they stay fixed for the duration of it, particularly the activity, but actually in terms of the work itself for the next 3 months, 6 months, however long that we have to manage these risks, and that can be really effective. And the thing with that is that then if there is a scenario where somebody within that bubble does become ill with coronavirus, then it's much easier then to identify who else who else might be exposed, that who else in that team has been exposed, and get them isolating, not coming into the office. And that kind of touches on the other thing to think about, which is your track and trace management. So, if you do have somebody within your workforce who does become ill, what's your process for then tracking who they've had contact with, and making contact with those people? So that might be within your workplace, but as we start to open up more and more, that might be customers that you're having contact with. So you will need processes in place for that management of if you like, your workplace track and trace systems. I've mentioned things like staggered start and finish times, but also break times, is a good way of, again, managing any pinch points or limiting the number of people who are together in one place at one time. One-way systems, again, very effective, particularly sort of for movement around a workplace where that's possible, but it's not always possible, but it's something to consider where it is. I've mentioned about, alternative security entry arrangements, so avoiding touch-based security systems. And you can also create work zones, a sort of an extension, if you like, of the work bubble. So where that's a fixed group of people, actually you can create a work zone, which is a fixed area for a particular activity. So there's quite a lot of sort of solutions there. And in terms of vehicles, then, again, we had quite a lot of questions in relation to this. Had a question come through a little while ago about car sharing and whether that was allowable. Well, unfortunately, it's not really. It's not maintaining social distance and minimising who you have contact with. But where you've got your own vehicles for your own workplace activities, then again, coming back to the one I've mentioned, keep a vehicle and a driver, keep them unique to each other if possible, but sometimes that's not. So can you restrict the number of people who use a particular vehicle? Keep it to 2 or 3, rather than rotating through greater numbers. In terms of the activity involving the vehicle, ideally, is it just the driver? But again, it might not be practical, depending on what you're delivering. You might need 2 people. Again, so it's minimising the number of people in the vehicle where you can. The hygiene is obviously a key one within vehicles, so the cleaning, the respiratory etiquette. Barriers within vehicles, generally you need to approach with caution. They're not necessarily practical, and they potentially introduce new risks in terms of if there was an accident, actually. So barriers aren't necessarily a practical solution in in vehicles, so it has to rely on the other things. You obviously consider personal protective equipment as part of that solution, but again, that's not straightforward either. So I'm going to focus particularly on disposable PPE in terms of sort of the management of COVID-19, so disposable face masks and disposable gloves. So, you know, we know we've got a lot of health and safety professionals on the line, so we know we use the term hierarchy of control, but we basically have a list of, you know, controls that are the best things to do, and it kind of, as you move down the list, they become less effective, and personal protective equipment is right at the bottom of the list in terms of its effectiveness. So you always need to look at other solutions first. I think one of the things with disposable PPE, and it's a really complex area, is that actually it provides a false sense of protection. There's a huge need for people to be reassured or assured in terms of managing the COVID risk, and you know, a lot of people are using PPE to give that assurance. You know, you can see why. I can see it. You know, it kind of, you feel safe if you've got a mask on. You know, it's your own like little personal bubble. But actually, the key thing with PPE is it encourages poor personal hygiene. So if you're wearing disposable gloves, for instance, you're not going to be washing your hands or using hand sanitizer with the gloves on, but you're still touching surfaces, and you'll be potentially still touching your face. So, but you're not doing the hand cleaning, the glove cleaning. So actually, they become an infection agent in themselves, and a mask in particular can create that, because if people are wearing either more formal sort of surgical masks or general face masks, then they're obviously contaminating the inside surface as they breathe or cough or sneeze, but the external surface is also being contaminated. So you've got this kind of almost this sort of double contamination going on, and you know, people again don't know how to take them on and off effectively, so they quite often will touch the actual mask to take it on and off, so again contaminating their hands. So there's a whole piece around that, and of course, you know, if people are wearing these items, you know, and they come into the workplace, you know, having maybe used them on public transport, and take them off in the workplace, you know, where do they put them? Are they putting them on the desk? They put them in the bag? How much contamination are they spreading or picking up as people use that? So it's a really complex area, and obviously there is a difference between you know, disposable face masks and face coverings that, you know, I think we're seeing most countries talk about and introduce, and actually the World Health Organization has just changed some of their guidance around this, and it's a really complex area, you know, and a lot of questions around, well, if somebody's coming in using public transport and using a face covering, you know, do they continue to use it when they get into the workplace, you know, and you're going to have to think through that as an individual workplace, and the key thing to understand is that it's like any form of kind of personal, so I'll phrase this carefully, but any piece of sort of personal clothing that somebody might wear into the office, you know, if there are particular risks in your workplace, that means that certain things have to be managed in certain ways. So particularly if you like food hygiene, then you're well within your rights to, you know, say, actually, no, it's not appropriate for you to continue to wear that in the workplace when you come in. So we've got a guide to kind of give some more information about what to look for, what's the difference between a surgical mask and a face covering, and how to manage kind of and look out for fakes, because this is a huge issue, and it's one of the downloads that's available. So I'm just conscious of time, and I do want us to have an opportunity for Q&A. So the last key area then is thinking about your vulnerable workers. So it's really identifying kind of the key groups in this space. So those who are extremely vulnerable, so they're the ones who have maybe been advised to stay at home or be shielded. You know, they're judged to be at high risk in terms of not contracting the virus, but actually becoming very seriously ill if they do, and the potential implications if they do contract the virus. the clinically vulnerable. So these are a group who may be, not in the same degree as extremely vulnerable, but may be more susceptible to illness, or more serious illness. So people with things like with diabetes, for instance, is a good example there. So this group, ideally you want them working from home, if possible. If they can't, again, the nature of the role or the activity or their need to come into work, and be earning, is can you create a situation where they maximize social distancing? So it might be that they can do, it's a slightly different job that they do for this duration, because that's an activity where they can maintain social distancing. Of course, there's our usual group of vulnerable people that we kind of expect to be looking at. Expectant mothers, young, disabled. They also need to be considered in terms of the aspects of COVID. So, for disabled, a really good example is, if you're in an office block environment, for instance, is what's their access to the lifts? How are you going to manage that? Some practical solutions. Within this group, you also need to consider that it might not be the individual employee who's vulnerable or is in one of these groups, but it might be somebody in their household, or housemate, somebody that they're sharing residency with, and they'll be really worried about bringing that exposure home. So my partner, his sister, has a wonderful fiance, but he's in the extremely vulnerable group, and she's not. And her workplace are talking about reopening and her coming back into the office, because of the nature of her role means that some of it needs to be on site, and she's really, really worried about that. Really worried. And this is something we'll touch on our next webinar. That has real implications on the psychological health, mental health. So it is something to consider. And the last point on this is the complexity of you're trying to do the best thing to protect these individuals, but also making sure that you are treating them fairly, and there's no issues in terms of discrimination. So that's where you may need to liaise with your HR and legal teams just to touch base with them in terms of what they're doing. So communication, communicate is really my message here. It needs to be clear, consistent and timely. One of the things that I've seen within BSI and also other organisations, is that people are watching the news or, in terms of what's happening or social media, and, there'll be some sort of change by the government or the WHO or that, and literally, that might happen at night on the evening news, and that, the next day, their employees want to know, well, what does that mean for me, for my work organisation? So that agility to respond quickly is really important. That it's reassuring and factual, and again proportionate. And this where it comes back to understanding the virus and giving that reassurance. And obviously, you need to be consulting and with your workforce and making sure that they're participating in their decision making, because they will be. Again, it comes back to that reassurance. So the more they're involved, the more they understand, the more reassured they're going to be. And for those of you who have got maybe sort of customer facing or might be interacting with the public, then you need to consider what your communication is with those. So I really appreciate there's a huge amount to cover. I hope that's given you a flavour and some guidance and some tips about what other organisations are doing. But BSI has produced 2 guidance documents, and there's links at the end of the presentation for finding these. So there's a new guideline document around safe working, which goes into more detail in terms of what you can do in your organisation. And there's also a new kind of special report, a sort of insight paper that has commentary from a number of industry people and experts about, what they're finding in their organisations and how they're approaching it and what it means. So I'd recommend those. I'm not going to touch on that. And, BSI can support you in a number of different ways, and most of you are very familiar with BSI. You know the way you can we can support you. For those of you who are new to BSI, we offer a range of services to help and support you.
So first of all, Kate, somebody's asked, should we increase the frequency of our health and safety audits?
Okay, great question. So I think you'll need to review your audits and what you're doing and when you're doing it, because there might be, again, in terms of what you've planned, there might introduce particular risks, social distancing for some of those activities. So you will need to review your audit protocol, and you may want to increase the frequency of some aspects of those. So for instance, or audits, or it might be inspections, but we talked about cleanliness and cleaning touch points. Well, actually that's something where you might want to be reviewing it much more frequently, either doing workplace inspections or doing audits, particularly maybe if you're using an external cleaning provider, auditing those to understand what's going on. So yeah, you'll certainly need to review it and consider what you're auditing and how often you're doing it, and potentially increase the frequency for some aspects and decrease the frequency for some others.
Fabulous, thank you, Kate. So I have another question here. What are your thoughts on doing emergency fire drill testing, as it's not possible to social distance in the drill? So do we put people at risk or not?
Okay, so in terms of your fire drill practice, again, it's a risk-based approach. A lot of organisations, again, depending where you are in the world, the first question is what's the mandatory requirement. If there is one within your country, you'll still need to maintain those. If you've got your own approach, you've adapted and maybe you're doing fire drills quarterly, well, that might not actually be necessary. And again, it's a risk-based approach. If you haven't got anybody in your office, you probably don't need to be doing fire drills, or if you've only got a few people in your office, again, you don't necessarily need to be doing fire drills as frequently. So I think, again, it's taking a risk-based approach to that. But I think the guidance is, as long as you're meeting your legal minimum, then that's your starting point, and then taking a risk-based approach. But it certainly is one of the areas that you might not want to do with the same frequency that you have been doing, but it is really important. And I know I've emphasised this again, but I'll take the opportunity to do it once more, to make sure that you've really clearly communicated to your workforce what to do in an evacuation situation. We've all seen that when the fire alarm goes off, everybody stops and kind of looks around at each other. That's going to be even more heightened, in terms of social distancing. People will be really nervous, so you need to have communicated really clearly that you get out of the office as quickly as possible. Social distancing doesn't apply in those circumstances, but maybe once they're out of the office, out of the building, then you can put other measures in place to then help manage that social distancing when they're out.
Lovely, thank you. Another great question here. Somebody's asking if you can share some tips on points that management should consider to support managing those working from home, and to ensure that vulnerable workers are healthy and their well-being is still ensured whilst they're working from home.
Okay, so I think we're going to cover this in more detail on our second webinar, when we look particularly at kind of mental health and sort of broader well-being. But I think the key things are understanding that different people will have different challenges if they're working from home. They might, at the moment, for instance, they might have childcare responsibilities and homeschooling responsibilities. They might not have a quiet work area. We've got offices all over the world, and we've basically close those in different scenarios. But one of the things, for instance, for some of our Asia offices, sort of Thailand and Vietnam, for instance, one of the challenges that they found is that things like just the internet connection is not very robust in a lot of the communities. And also those communities, they tend to have multiple people households, so it presents some different challenges. So I think it's understanding that everybody's in a potentially different scenario, and being sympathetic to that. But again, it comes back to really clear communication and regular communication. So one of the things that I've seen a lot of organisations do, and I do it in my own team, we call them welfare chats, but we have half an hour every week, and we just sit down with a cup of coffee and just ask everybody how they are, and just have a general chat. We don't talk about work, so so how's your homeschooling going, or or I was on a conference call the other day and my dog came and jumped on me and it was really embarrassing. It's ways of maintaining the humanity, if you like, and thinking about how you can do that. But as I say, it's something we'll touch on in a bit more detail in the next webinar.
Thanks so much, Kate. We do have a couple of other questions, but I'm really conscious of time now. So what we're going to do is, if we haven't answered your question today, we are going to come back to you after the webinar and make sure that's answered for you. Somebody has shared a bit of best practice, actually, saying that a client of theirs has added foot plates to minimise the use of door handles. I don't know if that's something you've seen, Kate, but I think that's a great idea.
That's fantastic, and that's a really good piece to share. No, I haven't come across that one, but it makes really good sense. So yeah, thank you ever so much for sharing that.
Lovely, fantastic. So I'm just going to quickly tell you about a few of the resources that we have available. You'll see on here that we have a number of links available to you. There are also 2 handouts that you'll be able to see on the right hand side of your screen in the box that you can download immediately. So we've gathered a number of links here today. We'll also be sharing some more resources with you in the follow-up email, and an opportunity to comment on a guidance document which is coming out for health and safety at the moment. So please keep an eye open for that. We also have, Kate's mentioned our webinars. This is a 3-part series. We hope today it was really valuable for you to really get you thinking about what we need to do right now. Our next webinar, which is on the 23rd of June, is all about mental health and all about supporting individuals and understanding the impact of COVID-19 on the mental health of your people, and the things that you can do to recognise that and support them through it. And then our other webinar at the beginning of June is all about the future. Somebody actually did post a question about, will this impact the future of health and safety? I think Kate would say absolutely. And we have a webinar on that on the 2nd of July, which is all about how we need to consider changes for health and safety as we move forward. So other than that, we've reached the end of today's session. I really hope you found it informative and helpful in helping you to prepare for the next normal, and also hopefully be able to understand how BSI are able to support you. Please remember, it's really essential that you follow government advice. So just something to be mindful of with all this support and guidance around. We really need to be following the government guidance. And all that remains is for me to thank Kate for presenting, and to thank you all for joining us, and to conclude with our final message. We hope you and your fellow colleagues and families and friends stay safe and well, and we hope to see you at our next webinar. Thank you very much.